It's again a great honor to introduce Professor Dominic Wilkinson. So when you have people of that stature, I mean, as a chairperson, they have two options. Either you have to say the whole thing, or you say nothing, because everyone knows him. Okay, it's again my great honor actually, and thank you, Prof. Roy, and the team to invite me to be the person introducing Professor Dominic Wilkinson. So he has multiple appointments, written multiple books, and that's over here. I will not go into it, I mean, when I read that, the heading, I was so impressed that I went back to your book actually to try to. So, yeah, should we give priority to the children? I think your time is more important than me talking. So, please welcome Professor Dominic.
Well, thanks so much, Zubair. Thank you, Prof. Roy and Mayo for organising a fantastic conference. It's a huge privilege, and of course, I have a slightly more different talk. I'm going to go in a more philosophical direction, perhaps of the style that Daniel beautifully gave yesterday. So, for those who are not philosophically inclined, hopefully I can make this still interesting and engaging for you. So I picked a topic that I thought was interesting. But then, of course, Julian said yesterday, he already told us, this conference is the most important topic. So I don't need to give this, so I can just finish right now, Nanette. But unfortunately, I made these slides, so now I'm just gonna force you to listen. But we already have the answer. Thank you, Julian. I thought I'd start by telling you about the HMS Birkenhead. So I don't know if you know the story. The HMS Birkenhead was a Royal Navy troop ship. And in the middle of the 19th century, ships like this, which were designed to transport large numbers of people, usually didn't have enough lifeboats for all the people that they were transporting. And this particular ship was shipwrecked off the Cape. It was carrying a large number of troops and civilians, and there was no way that they were a long way offshore. It was clear that not everybody was going to be able to be saved. And very famously, the soldiers, as captured in this painting, were ordered by their superior officers to stand back and allow the women and children on board to board the boats safely. And this famous, so they all stood there. The ship was going down, and they were all going to end up in the water. Most of them ended up drowning or being eaten by sharks. And this famous incident was celebrated in poetry. Rudyard Kipling had a famous poem on this, and in art. And it epitomized a particular norm of the era, the kind of Victorian chivalry. And it gave rise to an unofficial rule in the Navy and in the sea, a rule of the sea, of women and children first. And if those of you who've watched the film or read about the Titanic, that was encapsulated in the approach in the sinking of the Titanic. 74% of women passengers, 52% of children passengers on the Titanic were saved, but only 20% of the men. So, of course, if we think women and children first, then we're going to think children first is the right way to go. The norm of women first, particularly when it comes to opening the door, which was a generation ago a very, very standard norm, now feels perhaps anachronistic, perhaps linked with these kind of sexist norms of women as the inferior sex, and so maybe women first is now more problematic. But of course, children first, we're still happy to think children first, and of course we're all paediatricians, so we would think that. There's an interesting kind of ethical equivalent when we're thinking of this. There's a philosopher called John Torek who gave an example thinking about the philosophy. I'm going to come back to this example shortly. He imagined you're manning a lifeboat service, and you receive at the same time two simultaneous rescue calls. There's a little boat. In fact, there are two boats that are sinking and the occupants are going to drown. And in John Turek's example, he was trying to think about, should you go and save one person over here or 6 person over there? You can only save one. Nobody else is going to save them. You know who you don't go and save. They are going to drown. So the ethical equivalent of Turek's example is if we had a child drowning over in this direction, perhaps they're on a surfboard or something, they're over there, and we've got an adult over there. And we might think, look, this is pretty straightforward. We should clearly go and rescue the child. I'll come back to why we might think that shortly. And of course, if we're inclined to think that, then here's another hypothetical example. There's a global pandemic, and it's affecting the lives of millions of people. We have a new vaccine. It's very scarce in supply. So, of course, we should direct the vaccine to children first before we give it to adults. Oh, no, well, maybe it's not as simple as that after all. Okay, so what I want to do in this talk is talk a little bit about prioritization, the ethics of prioritization, how we think about that, how we make decisions, what type of values go into that. I'm going to introduce you to one particular philosophical idea that I think is very interesting and has got a role to play when we're thinking about priority, called the priority view, comes from Derek Parfit's philosophy. And then we'll try and think explicitly about the basis, the justification for giving priority for children and why we might not, whether it's give priority to children, whether it's justified or not. So trying to work out whether when we all in this room think, yes, the answer is yes, we should give priority to children, is this just special pleading? Because they're, of course, very important to us as people who care deeply about children. Thinking about the kind of sub-themes of this conference, I thought I'd try and draw some lessons for the different areas of this conference in relation to priority. So thinking about adolescence, which we started with yesterday, paediatric research yesterday afternoon, and then some of the tensions that we've just heard in thinking about home care and the other members of the family. So how should we prioritize? Well, we might just step back a sec. What are we talking about? Why is it that we're thinking about prioritization? Well, prioritization comes about when we've got something but not enough, when we've got scarcity, when we've got a resource that is just not enough to fulfill the needs or desires of everybody who might either need or desire whatever it is that we're after. And when in that situation, we've got a scarce resource, the question is, who do we give it to? Who first to give it to? Because we might be able to give it to everyone, but we can't give it to everyone straight away. The vaccines are potentially a bit like that. We're going to get the vaccine to everybody, but just not immediately. And sometimes we've got a finite amount, and we can give some to lots of different people, but maybe some people need more than others. It's like a cake. You give somebody a bigger slice. Maybe everybody else can have a bit of cake, but they're going to get smaller slices of cake. Well, when we're thinking about prioritization in medical ethics, so the organ allocation is something that's where this is clearly very relevant. There's a limited number of organs. There's always a larger number of potential recipients, and we're reasonably familiar. There's some fairly familiar principles that might go into thinking about that. One is who's going to benefit most from the organ. I'll unpack benefit in a second, but that's a kind of straightforwardly utilitarian way of thinking about this. And although utilitarian has a bad connotation, fundamentally utility is about doing the greatest good for the greatest number of individuals. It's not a kind of Nazi philosophy. Utilitarianism is about doing good for people. We think that matters. So benefit matters. We often, when it comes to acute interventions like this, whether it's an organ or an intensive care bed, we're thinking also about urgency. That's sometimes equated with clinical need. And although that might not be exactly the same as benefit, usually if somebody needs it more urgently, if you don't provide it to them, there will be a definite loss. If somebody needs it less urgently, maybe they can get it a little bit later. So So often urgency will also align with utility, though it will deviate. But clearly there are other ethical values, and one of the ethical values that's often at stake in prioritization is a desire to treat people equally, to give people's desires and needs equal weight. And John Torek, the philosopher, very famously struggled with the idea that we might just send the lifeboat to the boat with 6 people drowning. He thought, though I and most other people disagree, that we should toss a coin in that situation. Now, although I think that's the wrong answer, the principle of taking seriously everybody's needs and desires, and that at least some situations we ought to give serious weight to equality, seems also important. Okay. Now, there are different types of prioritization cases. This is, I think, a helpful way of dividing up prioritization cases, using some language from Parfit done in a slightly different way. So we can think of some cases of prioritization as different number cases. So this is like the lifeboat case of 1 versus 6, where we could either to save 1 person or 6 individuals. And in that situation, actually, although Torek claimed we should toss a coin, because that gives weight to the needs of, equal weight to the needs of everybody, if we give weight to the equal needs of the 6 versus the 1, that plausibly ought to direct us to send the lifeboat to save the 6. There is, I think, a strong reason to think that across most plausible ethical theories, we ought to try, if we have to save a greater number of individuals rather than a fewer number of individuals. And indeed, Julian and I, thinking about the pandemic, said, look, this is a kind of basic ethical principle. There are going to be others that we add on to it, but we ought to, if we're forced to, try and save the greater number of lives. And when we're thinking about allocation of medical resources, whether it's costs of treatment or the amount of time that we spend, lots of our resources do have this quality. If we spend more money on one patient, that will sometimes come at the cost of other patients who might have needed smaller amounts of money to save their life. If we spend more time on one patient, or we have one patient in intensive care for a longer period of time, several other patients may miss out on intensive care. If we give a larger slice of cake to one person, certainly if it might be that everybody just gets a smaller slice of cake, but it also may mean that fewer other people get cake at all. So different number cases are relatively, I think, ethically simple. Where it gets really tricky ethically is that in other cases we're talking about one person versus another person. They're what we could call same number cases. Do we send the lifeboat to the child or to the adult? Or to the adult who's 20 versus the adult who's 80? Or the disabled adult versus the able adult? What ethical principles might we draw on? Well, it was on the slide, but I forgot to mention it. When we were, some years ago, thinking about principles of allocation, we asked the general public in relation to both in relation to Torek's case, but also in relation to some dilemmas in neonatal intensive care. Subez just talked about neonatal population. Well, if we're thinking about allocating neonatal resources, we ask the general public, how should we make these decisions? They very strongly endorse this principle of save the greatest number. But the public also endorsed some other plausible principles that we might draw on if we're talking about same number cases. They clearly identified that if other things are equal, we should save a person who's got a higher chance of surviving, who's going to live for a longer period of time, who would have a higher quality of life, or a younger age. Younger age and duration of survival will often run together, but not always. And clearly, those sorts of qualities, characteristics, are going to align with a utilitarian approach about maximizing the benefit, but conflict with an egalitarian approach. So when should we choose a less good outcome? When might we prioritize and sacrifice benefit or sacrifice utility? Well, in one of his great books, Tom Nagel's 1979 book, Mortal Questions, he gave an example that actually I think is going to seem very resonant for some of the discussions that we've had today and yesterday. So he imagined a family who had two children, one of whom was healthy and happy, the other of whom has a very significant and painful disability. And the family were making a choice, like some of the families that we've talked about making difficult choices, but a choice that was in effect going to be better for one child or the other child. They could move into the city closer to the medical facilities that their disabled child would need, but that would come at the cost of all sorts of elements of the quality of life and education of their healthy child. They could move to the suburbs where the quality of life and the access to school was going to be much, much better for the healthy child, but worse for the disabled child. And in his example, Nagel stipulated, so this is a thought experiment, of course you're going to look for the sort of compromises, but he's going to stipulate you can only do one or the other. And the claim was that the well-being gain, the improvement in well-being for the disabled child was going to be less than the well-being that would be sacrificed for the healthy child. So in terms of utility, it was clear that this couple should make a decision in favour of the healthy child. They should move to the suburbs, although that would be less good for the disabled child. The amount it would be good for the healthy child would be better than the amount it would be bad for the disabled child. Now, Nagel's point was, in thinking about this, many of us, myself included, have a strong intuition that that's the wrong decision, that the parents ought to make the decision in favour of the less well-off child. Now, why might we do that? Well, Nagel didn't quite use this language, but Derek Parfit, the great Oxford philosopher, talking about Nagel's view, highlighted that clearly that decision is wrong from a utilitarian point of view. It would generate less well-being overall. One thing that Nagel claimed was that an egalitarian view would prioritise the disabled child, the child who is worse off, because that would make the children's well-being at the end of the day more equal. The disabled child would be a bit better off. The able child would be less well off than they already are. But Parfit made a claim that was important, I think, and made an important distinction, which is that there's a different way of explaining why you should potentially prioritise the less well-off child, and that is because the well-being for them, the improvement for them, matters more, that it has greater weight. It's a smaller benefit, but it matters morally more. That benefits to the worse off perhaps have greater ethical weight. So this is what he called a priority view, and has often been described as a prioritarian account. And there are several key elements that I'll just briefly highlight. First is, when we think about priority for the worst off, it's not relative. So it doesn't actually matter that the other child is better off, or how well off the other child is, or even how many other healthy children are. The extra weight for the child who's worse off is because they're already worse off. So it's a little bit like the inverse in direction. When it's more difficult for you to breathe as a mountaineer at high altitude, it's not more difficult for you to breathe because you're higher up than other people. It doesn't matter that other people who are lower down on the mountain are finding it easier to breathe. If there were none of them, you would still be finding it more difficult to breathe. Okay, it's because up there it's harder to breathe. So invert this diagram if you like. It's because the lower well-being matters more, is more difficult for the individual. On this account, there's no intrinsic value to equality, the fact that individuals are equally well off. So one of the points that Parfit makes is that on the egalitarian view, it would be good if both children were well off, but it would also be good if both children were badly off, because then they would be equal in well-being. And one of the ways you can achieve equality in lots of instances is by benefiting nobody, or by making those who are currently well off worse off. But plausibly, at least to many philosophers, that's a philosophical mistake. It's a mistake to make some people worse off so that everybody's equal. Nobody benefits by that. But the last point that I think is often misunderstood about the prioritarian view that Parker was clear about is that priority for those who are worse off is not absolute. It doesn't take precedence over all else. It gives some extra weight to those who are worse off, but that's in many situations going to be or in some situations at least, going to be outweighed by the greater benefit. So if the benefit to the better off child were very significant and the benefit to the worse off child were very small, although that small benefit has extra weight, it's going to be outweighed by the greater benefit to the person who's more well off. Lastly, just very briefly, when we're thinking about priority, I've talked about priority for the worse off. There might be other types of reasons, and we can come back to thinking about them in terms of children, for prioritizing somebody not on account of how badly off they are. We might think about safeguarding the future. We might think about somebody's vulnerability, though arguably vulnerability here is kind of aligning with the idea that somebody's very badly off. We might think that we have a duty to we have a duty to particular individuals to prioritize them, so those who are related to us or to whom we have particular relationships. Again, that might be relevant to children, though often when we're thinking about prioritization, what we're trying to do is to step back from our individual relationships and to manage a scarce resource across a number of individuals. So that often won't give us a strong reason to prioritize one group over another. Okay, so that's the theory bit. How do we think then about children? So should we prioritize children? Well, I said different number cases when we're going to save more lives, save more people in the boat, they're ethically easy. And in many cases, priority for children will be like a different number case. And that'll be the case where treatment of children, early in life, prevention, etc., will actually be cheaper than treating people with established illness later in life. They may need a shorter duration of treatment. They may need a smaller dose of the medicine. If you've got a finite quantity of vaccine, if you can give smaller doses to children, you can save more children, you can benefit more children. So there are going to be a number of cases where priority for children is easy to justify on the sort of rationale that everybody ought to agree on. We can benefit more children, we can save more lives. There'll be other cases, though, where we've got same number cases, and on straightforwardly utilitarian grounds that I've suggested are plausible and important considerations. So children we might prioritize because they've got a higher chance of survival than the older person who's also got pneumonia or also got COVID. They're going to survive for a longer time. That's usually going to be the case. Our neonatal patients tend to, even those who are extremely preterm, survive for many, many years. We have, so that's one of the reasons why neonatal intensive care is much more cost effective than pediatric or adult intensive care. Often children will have a higher quality of life than adults who might be competing for treatment, and they may also be in more urgent need. But if those are our basis, then it won't always prioritize children. So sometimes at least adults will have a higher chance of survival than an ill child. Will survive for a longer time because the child has an underlying severe chronic illness, genetic disorder, Pompey's disease, etc. The adult will have a higher quality of life or more urgent needs. So these types of principles will often, but not always, lead to priority for children. So one sort of preliminary conclusion is, if we're thinking about prioritization, often priority for children will be justified on a straightforward notion of maximizing benefit. But does that actually translate into our decisions? Well, we might look at our spending across the age span, and it looks like we spend an awful lot more for those who are very old than we do for those who are very young. And the per capita spending enormously increases over people's age. That doesn't actually tell us that we're not prioritising the young, because that's, of course, where most of the burden of illness is. So you'd have to look at spending relative to burden of illness and effectiveness to be able to work that out. And I haven't found a good source that does that. To look at it a different way, to zoom out, in terms of burden disease, there's lots of burden of disease globally in the very young. There have been some very significant improvements in recent years, but not as fast as the Child Development Goals, which we heard talked about yesterday by Erwin. So we might wonder whether children are getting sufficient priority in terms of those decisions, but again, it's a bit difficult to say, partly because it's hard to see where all the money is spent across different priorities. But we might suspect that at least sometimes children aren't getting priority that would be arguably justified in terms of the greatest benefit, and that there are some obvious political explanations. Children lack political power. They don't get elected to be president. They don't have a vote. They often are voiceless. We heard about children lacking voices for reasons of tracheostomy, but of course they usually lack a voice for other more straightforward reasons. And of course they're often in other parts of the world. The bulk of children, of course, are in developing countries, low-income countries. They're not necessarily in the places where all these decisions are being made. There's some interesting questions, which I'll set aside, about ways that we might try to address some of these, including, I think, some provocative but worth thinking about arguments about whether we ought to be enfranchising children, giving them a democratic voice. But anyway, I'm going to set those aside. The last bit of this part of the talk, I am probably going to run over, apologies Nanette, is whether we ought to give priority to children on these other ethical bases, so separate from the utilitarian bases. Because when we give priority to children because they're going to live longer and they have a higher chance of survival, that's not actually, on a prioritarian account, giving priority to children is just recognising that that it'll often be better overall. So one thought is whether there are situations when, for example, you have a young person and an older person who might live for equal amounts of time, where you ought to prioritise the younger person because they're worse off. So why might we think they're worse off? Well, one reason is because we might think that it's worse off to die when you're young, that somebody who's lived and enjoyed life for a longer period of time is better off. That sort of principle might lead us, if we've got a scarce organ, to say give it to a child rather than an adult with organ failure, where they both are likely to die in the short term if they don't receive an organ. That's going to lead us towards prioritisation, potentially, of children with life-limiting illness like rare genetic illness. What about non-life-saving treatment? Well, here we've got to think about, we have to unpack, and I'm not going to have time to think about, how do we understand badly off? Sometimes we might think that children are very badly off relative to the adults who might be competing for treatment. But again, it's not always going to work out that way. There are a number of adults who've been unwell, disabled, etc., for very long periods of time. We might think they're really very badly off relative to children who might have been unwell for a shorter period of time. So the priority view isn't always going to prioritise children. So here's a second conclusion. We should sometimes prioritise children, even when it's not going to give us the greatest benefit. For example, because we think that dying younger is worse than dying at an older age. I'm going to, in the last few minutes, talk about think about some of the examples that we've referred to in this talk. When should we, or maybe not prioritize children? Some of the interesting questions I'm going to leave dangling a little bit. So one question, going back to the start of this conference in relation to adults, is if we're thinking about priority for children, are we just talking about the cute little children up here? It's very easy for us to want to give priority for her. But what about the surly, pimply teenagers? Are they included or not? And are we going to prioritize her over him? So is this sort of priority fixed or is it variable? Are we going to give priority for younger versus older children? I have an intuition, which is that adolescence is really bad. And this is partly because I'm a parent of several adolescents. I'm inclined to think that the period of adolescence is really, really bad. It's actually, I think objectively, certainly subjectively, the worst period of life. So if you're unwell in adolescence, I think maybe we should give priority to adolescence. And maybe there are certain types of subjectively awful illness, mental illness in adolescence, that we might think ought to really rise up our priorities. So here are some kind of different types of possibilities. If we've got our organ transplant, we're going to transplant the 17-year-old who's still technically a child versus the 18-year-old who's now technically an adult. What about an 8-year-old versus a 16-year-old? Newborn versus an 8-year-old. On the benefit view, we're going to potentially prioritize those who are youngest because they're going to potentially live for the longest period of time. On the priority view, we might have to engage with this idea about whether it's actually as bad to die as a newborn than to die as an older child or an adolescent or maybe a young adult. I'm not going to settle that question right here. What about children's research? Should we be prioritizing research for children? Should we be opening the door first for children? Well, here we didn't really, we suggested towards it yesterday. One of the worries is that by promoting research in children, sometimes we may be subjecting them to risks and harms. And so that we might worry whether priority ought to lead towards protection of children from risks of research or to promotion of research. And of course, when we don't do research, that leads to harm to children overall. We might also be interested in thinking about which area of research we should be focusing on. These are the list, just out of very brief interest, of the NIH funding categories. And on the right, which here we are. So those things down the bottom are, in terms of disease burden, underfunded. So they include a whole lot of unsexy things like viral skin disorders, psoriasis, acne for teenagers. Is obviously hugely significant, but they tend to be the things that are lower priority in our imagination. So if we're thinking about priority in children, we might think about which conditions we want to prioritize. Very, very briefly, last of all, we heard some of the dilemmas in home care, and one of the challenges that we haven't really articulated is that sometimes priority for this child with illness, like a child with disability in Nagel's case, will come at the cost of another child or other children in the family. And clearly, one of the anxieties about transporting the NICU to the home ventilation in the home, palliative care in the home, is that, well, sometimes that'll be good for the whole family, sometimes it'll be good for this child, but bad for other members of the family. So how should we think about this competition within the family? This is a kind of micro prioritization. Well, if we think that children should get priority, that might lead us to give greater weight to the interests of the child versus the interests of parents. Sometimes decisions are going to be better for the child, but worse for the parents. But how do we make these decisions about competition between children when treatment for this child will seriously set back the interests of other healthy children? So I don't have an answer for you here. Again, we might worry about how old these other children are. Are they adolescents having a miserable time? How many of them there are? I said different number cases are easy. So maybe if there's lots of other children, that's going to make this now look like an easier case. As I've alluded already, priority for the child, priority for the unwell child, although it's important, it's not absolute. So there are going to be situations where these other needs are going to outweigh it. I'm just going to wind up here. We've talked about priority, the kind of ethical principles of prioritization. I've tried to unpack how we might think about priority for children. Clearly, it is important. In most cases, it's going to be justified for the sorts of reasons that I've articulated to give priority to children. It doesn't always seem to pan out. I've talked about some particular cases where we might give priority even when it would yield a lower benefit. For example, childhood life-limiting illness, adolescent mental illness, where we might think they're particularly worse off. And I've alluded right at the end to this important principle, which is priority is not absolute. There are different ethical values, but also, of course, different stakeholders. So even if we give priority for children, sometimes that will be outweighed, for example, by greater benefit to older individuals if we're allocating vaccines in a pandemic. Thank you very much.